The United States healthcare death spiral has begun. Right now, a structural design flaw in one of the largest industries in America, healthcare, is crushing the backbone of its own economy, small business. Look at it this way. Imagine you, Elon Musk, and Jeff Bezos all walk into an Apple store to buy the exact same iPhone. You're charged $1,200, Bezos pays $600, and Elon only pays $500. It sounds ridiculous, but it's exactly how employer healthcare works in America. Massive corporations like Amazon, Walmart, and Tesla often pay dramatically lower insurance costs per employee than a small business with 25 employees for the exact same healthcare. And this problem affects the small business owners who maybe decide that they can no longer afford to provide insurance for their employees. It also affects millions of Americans. I'd personally argue it's one of the main reasons why, even though you might make more money than your parents did at the same age, you probably can't afford a house and really feel like you can't afford life. Your buying power from salary increases, if you happen to even get a salary increase, doesn't do as much as it used to. So how did we get here? Well, to understand US healthcare's design flaw, we have to look at three specific forces driving this entire crisis. And then we'll look at how savvy small businesses are fighting back against these forces, and not just helping their own businesses out, but actually helping their employees as well. Let's dive in. So to help us better understand the three forces creating a crisis for us and how this death spiral is about to affect all 50 states, I want to share a quick story from a small business owner here in California. And most people know this already, but small businesses are an engine of employment in the United States. Nearly half of the US's private workforce works for a small business. Kirk Vartan's business is a pizza shop that employs 25 workers up in NorCal. As a business, he can offer his employees health insurance. And this is how 167 million people in the United States get to see a doctor, through their work. Now, Kirk himself is a pretty healthy guy, and his wife's healthy as well. Yet somehow they have to pay $2,000 a month just to cover both of them under their work plan. Back in 2008, they would have paid roughly $1,000 a month. But that's just inflation, right? Well, the inflation adjusted equivalent of $1,000 in January of 2008 is $1,577 today. So the cost to see a doctor for small business employees has increased at least 25% more than general American inflation. There is some variation in there, but not really too much in California or for small business. And if you're sitting there thinking, who cares if a business owner has to pay a little bit more money for health insurance? Well, you should, because those cost increases are a direct parasite on your paycheck. When insurance premiums cannibalize a small business's cash flow, that money has to come from somewhere. So often it gets stripped straight out of the fund meant for your next end of year bonus, your cost of living raise, or hiring extra help so that you're not completely overworked. For many small businesses, the minute they begin to drown from medical hyperinflation, it's the employees who suffer the consequences with stagnant wages. And this is just the beginning of the death spiral. Let me explain. Traditional health insurance works by pooling or putting together thousands of different small businesses together to balance out the financial risks so that the insurance company can still make a profit. Remember, they're in this for profits. They have shareholders. So some of these companies with healthier employees will realize that they're effectively subsidizing the companies with sicker employees. So some have decided to pull their entire workforce out of this market and experiment with alternative options. But with the healthy companies gone now, the traditional insurance pool is left with only the highest risk businesses, the ones with the older and sicker employees, leaving them no choice but to stay. And because these sick ones stay, the remaining pool is suddenly incredibly expensive to cover. So insurance companies raise the premium prices even higher the next year. This forces the next wave of healthy small businesses to flee, which in turn increases prices. And this loop basically repeats until total collapse. And if you want to see what it looks like when the corporate death spiral hits its absolute terminal phase, you just have to look at Connecticut, who's actually a few years ahead of the rest of us. The share of small businesses in Connecticut that are able to even offer health insurance there has plummeted by nearly 25%, the single worst decline of any state in the country. The market got so high risk that major insurance companies looked at the math, they packed up and completely abandoned Connecticut's small business pool altogether. And this left the remaining small businesses with really no bargaining power. They were forced to accept whatever insurance increases that they got from the remaining insurance companies. So what's the real cause of this death spiral? Meaning, why are healthcare costs increasing so much in the United States? Everyone screams insurance, and yes, partially, but it's more than just insurance. Here's the three primary drivers of this death spiral in the US. Massive hospital chains have been swallowing up independent community hospitals and doctors' offices in recent years. This is a problem because at an independent doctor's office, removing a full arm cast averages $43. The same procedure at a hospital and clinic costs $298, 7 times as much. And in the majority of American cities, the top 2 hospital systems control more than 75% of the market. And once they control a market, they can use their market dominance to artificially increase prices, forcing insurance companies to pay double or triple what a procedure actually costs, which leads us to the second second driver. So in theory, insurance companies are supposed to be on your side when it comes to prices. The idea is that they use their size and negotiating power to push hospitals and doctors to accept lower rates, so you don't get stuck paying a full sticker price or the charge master. But that doesn't always happen, and one potential reason is that insurance companies are regulated by something called the medical loss ratio, or MLR. It says that they have to spend about 80 to 85% of the money that they collect from premiums. They have to spend that money on medical care and health-related costs. That other 15 to 20% they get to keep for administration, marketing, and of course, profits. And for the most part, most insurance companies are not maliciously gaming the system. They're only playing by the rules that Congress set for them. If your profit margin is capped at a fixed percentage, the only way to make more absolute dollars is if the total cost of healthcare goes up. Which brings us to an actual confirmed driver of higher healthcare costs. Wall Street firms have spent billions of dollars in recent years buying up hospital infrastructure and emergency rooms. Many have loaded these facilities up with massive debt, stripped down the resources, and aggressively hiked up medical fees to maximize their investor returns. The number of private equity deals to buy out doctor practices skyrocketed 600% between 2012 and 2021. And studies have found that private equity acquisitions of medical practices increase prices in 8 out of 10 specialties. For a visit to a cancer oncologist, prices increased 16.4%. A digestive gastroenterologist, 14%, and ophthalmologist, 8.7%. So that's why costs are increasing in this system. So how are companies getting out of this death spiral? Well, both for selfish reasons and to help their employees, they're changing how they fund their healthcare. Remember when I said that big corporations like Amazon and Tesla pay less per employee? Well, being bigger does help them, but the real reason that they pay less is that they've bypassed traditional insurance years ago. They use a model called self-funding, where they basically pay for their employees' doctor bills up to a set amount for all of their employees. They become their own insurance companies, but this won't work for every small business. I mean, most small businesses aren't making money the way Amazon and Tesla are, where they have so much extra money that, if there was something catastrophic that happened, they could just pay for it. Most small businesses would typically struggle to pay an employee's $1 million cancer bill. So many small businesses have turned to a middle ground called level funding. It's in between traditional health insurance and self-funding. In the traditional model, small businesses write a giant check to an insurance company that covers the risk for them and all those other businesses I mentioned, even the ones that aren't as healthy. If all of their employees are healthy, that money just goes away. There's nothing that they can do about it or reclaim. Basically, they're paying for the entire pool's health. But level funding allows those businesses to get some money back. Here's how it works. Still working with an insurance company, a level funded plan splits the monthly insurance payment into 3 distinct piles: admin fees, cash amount for actual doctor visits, and an emergency backup called stop loss insurance. Basically, if some employee at the small business did get a $1 million cancer bill that year, there would be some cap on how much the company would actually have to spend toward that. But if their employees were generally healthy and maybe don't even use the doctor that much, that leftover money in that doctor visit fund can be shared between the insurance company and the small business. And this brings us back to what I was talking about in the beginning. This is essentially reclaimed money. For the small business that want to give their employees raises or a true cost of living adjustment, they finally have a path to do that. If you found the video interesting, you'd like to see more like it in the future, please consider subscribing for more. This is Tyler Dutchover. Thanks for watching.